Good evening, friends. Welcome to yet another edition of Voice of Healthcare Futuristic Friday, an interactive discussion format that focuses on delivering insights on the latest and emerging trends in the healthcare space. Hi, I am Jatin Mahajan, Managing Director of Mitra Co Company, and your host for this evening. Technology and internet has dominated the healthcare space in a very big way. Artificial intelligence is now a word that we hear on a day-to-day basis. But the question is, do we understand its term and its significance with respect to the healthcare space? Today we have with us Ms. Preeti Syal. She is the Senior Specialist Health Policy at NITIAayog, and she has worked in the space of emerging technology. At NITIAayog, she has been given the mandate for responsible adoption of AI across the sectors and emerging technology policy in the healthcare and justice and legal system. So let's talk to Preeti Syal on how AI is going to be the game changer for the healthcare space, specifically now with respect to the pandemic. Preeti, welcome to Futuristic Friday.
Hi, Jatin. Thank you. Thank you for having me.
Yeah, awesome. I hope I have not left out any important aspect of your introduction.
No, that's not important at all. The conversation is more important.
Yeah, okay, great. So let's jump right into the subject of our conversation, which is AI, artificial intelligence, as a game changer for the healthcare space. So my first question to you is, what is artificial intelligence? And it'll be great if you can explain with an example with reference to the healthcare space and how it can be a game changer.
Okay. Thank you for that question. Starting from the basics, I think is always a great thing. I think that every time that question is thrown across, there are a variety of answers that people come up with. More often than not, people say artificial intelligence, and they usually begin by the textbook definition that AI is when machines try to emulate human intelligence and behavior. And when you're trying to put that definition, then you also add a doomsday interpretation that the ultimate goal is for these machines to replace humans eventually. This, however, is far from the truth. Because we haven't really finished defining what does intelligence mean. As humans, we don't know what does intelligence mean in its entirety. There is cognitive intelligence, there is skill-based, expertise-based, perception-based, and so many other categories that we know of as far as natural life forms are concerned. And B, AI by itself as a technology is supposed to be a facilitator, a technology that makes life easy by observing and interpreting trends or giving insights that our limited human brain is incapable of, so to speak of. So that we can then take these informed decisions based on what this technology is empowering us to, as far as interpretations are concerned. If I were to think in terms of healthcare, for instance, the reason why we all are already being vaccinated across the world today is because some machines out there have the expertise to reduce the turnaround time of parallel sequencing computations, which are the sequencing computations you usually do for vaccine when you're discovering the vaccine or trying to find what would be the ideal candidate that can probably go for a field trial. It used to take years to do that and decades sometimes. Right now, that has been reduced to a few weeks and months maybe. And that has mostly happened because of the next-gen sequencing technologies, which are powered by AI. So AI is here. It's not some dystopian, game-changing future. We are living it. So I every time I look at the entire of course, the pandemic has limited us in so many ways, but the turnaround time for vaccination, I don't think would have been possible so fast until this year. I mean, we've had this amazing technologies that could make it possible. I don't think it was possible before. Over to you.
Yeah, and in fact, what you say makes sense because when we have large amount of data crunching, AI is the go-to tool because ultimately it's an input to an output. And this is my next question, which is basically how has AI demonstrated its effectiveness in times of Corona pandemic? If you can throw some light on this.
Sure. Again, vaccination was one example. There are several examples, and I'm sorry if I miss out on some of those, but I think I'll just quickly mention few that come to my mind. One is this healthcare technology company called Cure AI. What they do is, I'm sure people have heard about them. They automate X-rays overread in seconds. You don't really need radiologist or human intervention for it. So by doing that, they are kind of reducing the overburden doctors and radiologists right now. You don't have to constantly monitor how your lung infection is progressing. You don't have to you don't need humans to estimate percentage area of the lung and track changes which happen with each chest X-ray. The Cure AI software helps you do that as you just take the X-ray, and within minutes and seconds you'll be able to have that differential diagnostic results out for you. So I think that by itself is very helpful because sometimes you have your X-ray, but you don't know what does that even mean, and you need a doctor's opinion or a radiologist's opinion to make sense of it. Especially today when we are seeing increasing number of lung infections across board, and it's just to get access to a medical opinion is so difficult. Even if you don't have symptoms, the amount of fear that exists across board, I think just allaying that fear by itself is such a great contribution. Even if you, and by the mechanism of just doing that, I think you're enabling people to have access to healthcare information and reliable healthcare information, which you didn't have before. So that's a great example. The other one that I've seen is there's a disaster management. I'm sure a lot of people must have seen it. It's been making the rounds in social media a lot. There's a disaster management dashboard currently being used by the state of Kerala. It basically, what it does is it has this entire map of Kerala, its districts, on where the needs are. So it's of course there's a lot of GIS that is powering it, but then there's also a lot of back-end knowledge of, okay, this is what the resources needed at X state right now. This is the run rate for how long oxygen will last, and they're trying to be proactive about supplying oxygen at those centers and making them priority. So making decisions about where the demand is, how much is the supply, how low you are running on both the ends, and trying to make them both meet, especially in a disaster scenario. I think humanly it might have not been possible to do that. And then Kerala, the state of Kerala is doing a really good job in managing their, yeah.
So basically, just to expand this, as you said about the state of Kerala, I'm sure, there are a lot of areas where we need to deploy AI. And, my next question is, how can AI be used to expand access to healthcare in rural markets or underserved markets or developing regions?
So again, one size fits all, because India is so diverse and
Yes.
we have so many variables in each state. One thing that works in one state can possibly not work. There are cultural differences. There's a lot that needs to be taken into account before you even think of deploying any futuristic technology. And AI, although it exists right now in urban cities in so many ways, as you correctly said, there are a lot of things that you have to take cognizance of when you think of deploying them in rural or underserved areas in the country. As far as we are concerned, so NITIAayog has been trying to do has been trying to push for greater adoption of technology across the last mile healthcare continuum, to facilitate these greater adoption across all of this, especially the last mile, I would say. We've been trying to come up with some AI-driven platforms and applications, which work with our partner field organizations, so that, if I'm an ASHA worker or an Anganwadi worker, A&M or medical officer, I have to understand, how will this help me in my job? And this technology is not going to add burden to what I already am going through. And then finally, trying to also understand that there is a digital learning gap that exists. If I am just, I cannot just pick a technology and throw it out there. Just go figure. We cannot do that. So, that there's certain technology that has a benefit, but then adoption in the community by itself has those gaps. So having said that, and knowing all of that, the moment you pick a technology, you start both the things in parallel. First, is there a need for this? You just because building technology sounds fancy, but do you really need it? So after doing all of that methodology, we have finally, curated these 3 big solutions that we think will help bridge the gap and also enable these frontline workers to in their day-to-day jobs. So one of them is a project called Healthcare AI Catalyst. We are running that in partnership with the UK Treasury, Elsevier. Piramal Swasthya is our field partner, and Lady Harding College. So as you can see, the team's composition is really important. You really need public health experts, you need field workers, you need technology experts, and of course the money to run those pilots. So the Catalyst project, what it does is it serves as a digital tool which empowers ASHA workers with clinical decision support system. It's currently being piloted in Bahrain, Uttar Pradesh. The idea is, if I am an ASHA worker and I go to visit a mother who's pregnant, and she asks me, Didi, I want to take XYZ diet. Do you think it is recommended? So for her, the first point of contact is ASHA, right? So then ASHA, right now, they are not really empowered as far as the clinical decision making is concerned. They have to refer that person to the next level of chain as far as health diagnosis is concerned. So this support system by itself allows them to put in patient history, details of all of the complications that they have seen so far. And based on that, this support system helps them monitor and make suggestions for nutrition, for how should they be monitoring their entire pregnancy, and of course after that also. So in some sense, you're kind of shifting the burden of a patient care from PHCs, CHCs to these frontline workers and enabling them in the process. So by itself, that pilot has been really helpful. That is one. And then we have another one where we work with Vadhvani AI, which has a 3D model-based AI tool. It helps anthropometric values, measured to help anthropometric values of newborns in order to monitor and manage low birth weight. And again, in India, that's a big problem. And I cannot emphasize enough the challenges we constantly face in trying to address low birth weights and stenting related concerns in babies. So monitoring is a big part of it. For expecting that ASHA worker would carry weights, carry those weighing machines with them all the time, and be able to do that exercise every time they visit the community, it's too much to ask for. So we are trying to come up with this simple 3D model which helps them assess, like you take a photo of the child and you're able to kind of assess if the child is growing, progressing. And in some sense, it's very similar to what Cure AI is doing, but that application is for chest x-rays, and this is for monitoring the baby height and weight. So in some sense, image identification, recognition, and in trying to build intelligence out of pathology, radiology images, I think that in itself is a huge market. And we are beginning to see early results of that. So this pilot, again, that I talked about is kind of that. There's another third project that we are doing in diabetic retinopathy. That was the initial concept model, came across the world via Google, and then slowly a lot of startups. So we are working with a few India-based startups which are helping us create this solution where you automate and early detect corneal damage in diabetic patients using AI tools. This would be done with the assistance of PGI Chandigarh, and the pilot will be in Punjab. So these are, I mean, again, we can only figure out and help prove that these technologies work. We've figured out the behavioral change that is needed to scale these. Now, since we are not the implementing body, eventually states have to pick these solutions up and be able to adopt and accept them the way they are proposed.
I think the way you have explained these three pilot projects, it shows that AI can be deployed in other areas as well. And I think the proof of the concept, what you have been sharing, and the kind of outcomes that you've been sharing, that we have got wonderful outcomes, shows the significance of the AI necessity in country like India. Uh,
Definitely.
yeah. So what I wanted to understand was, taking this forward, there is another area where you can deploy AI. Now, the question is, how can we use AI to convert EHR, which is the electronic health record, into a basis for a reliable health indicator or a predictor?
So part of these, again, when we are doing these pilots, we also take into cognizance that eventually all of this, it should not just be we created a system and a framework for a pilot. अब ये यहाँ पे पड़ा हुआ है बस. Nobody can use it. We don't want that, right? We want that somebody should literally pick this entire ecosystem and just scale it from there. So in that sense, we are also looking at how all of the digital tools in the back end are plugged in to ensure that there is interoperability as far as all of this data collection is concerned. So all of these pilots take into account what NDHM has been trying to do since last year, when everybody was beginning to get their digital IDs, the health IDs, unique health IDs. So we have tried to make sure that every person who comes on these pilots, whoever is the subject for these pilots. So let's say, for example, the Bahadej pilot that I talked about, we had 200 patient stories. So all those 200 patients now have a digital footprint. So in some sense, it is also allowing these patients to have a digital footprint, which will eventually be a part of their electronic health record, right? So in the back end, if I know that, okay, there were N women in X area in year 2021 who
Right.
faced maternal nutritional issues, and of course all of this data is anonymized, there's no privacy breach anywhere, but I have a reference in the back end that I know that this area was prone to some issues, but they were corrected doing n number of steps. So in some sense, that is a proof of concept that n works, and any other state can use that as a model and implement at their end. So by itself, we are seeing early results of how EHR can direct policy decisions. It can direct implementation decisions on ground and help make, as I said in the beginning, informed decision making, because you have all of this front end and the back end talking to each other, which rarely happens in governmental systems most of the times. So I think in that sense, this is very heartening for us also to see.
I mean, it's amazing to see such transformation is happening across the healthcare space in India, because it's not that as if we don't have data.
Yeah.
We have a lot of data. I mean, terabytes, gigabytes, petabytes, and all that. But we need a tool to actually crunch that data and get meaningful, results from that data. So I am sure that in times to come, and as what you have shared, these three examples, pilot examples, what I say also is the proof of concepts. I'm sure that when we get meaningful results on the ground, uh, the other states, I do understand it's a state subject also, but they will be actually tempted to use these technologies, because ultimately it is benefiting the entire value chain. So whether it's a consumer, whether it's a patient, whether it's a doctor, whether it's the starting point, because all those things will be on data, and data doesn't lie. And I feel that data gives uh, is a good thing for analysis. So my next question, which is like, is, healthcare space may be divided into a lot of broad categories, which some of us have already covered. And AI has also proven its efficacy in those areas which you have shared. So I wanted your insights on the other areas as well. Maybe you look at the testing and diagnosis area, maybe the surgery or treatment area, or even in terms of the remote treatment delivery and consultation. Because now in pandemic, what has happened is the senior people above the age of 60, they hesitate to go out of their homes. And the way forward, and even doctors are concerned to maintain their own health and safety. So I think they are doing a lot of consultations on through the Zoom platform, or through telephones, or what we call as deploying technology. So any comments on that?
Hmm. Yeah. So actually, I do some part of that I already covered in my conversation, as you
Yes, yes.
rightly pointed out. But Jatin, I think one thing that you have really touched upon, the remote treatment delivery and consultation, and right now, it's regardless of age and gender and location. Right now we are seeing that the need and the demand is everywhere. So the good thing is, again, that we had started some semblance of we enabled a lot of telemedicine platforms early last year, when the pandemic had just started. So
Right.
there were telemedicine guidelines that came out. The Niti Help formulated them, and Ministry of Health put them out. So those guidelines kind of empowered a lot of healthcare providers, and of course the people who are trying to access these services, in the sense that initially people would hesitate from writing prescriptions because they would think that this is not valid if it's done over a phone call. They would actually always ask for a physical prescription. So the guidelines empowered them to have those resources. So sometimes it's technology, and sometimes it's just simple enablement. Because think about it, in today's world, having a video call is not really a difficult thing from technology perspective to implement. The challenges you face are, if I go far away, do I have the network connectivity for people to be able to even connect, or resources for that matter? I use a feature phone. How am I going to connect to a doctor via a video call? And then my only option is text based or phone call based consultation. So in that sense, working backwards, having that backward compatibility across platforms is also really important. And we do take cognizance of that. In fact, right now we are trying to figure out how to ensure that this plethora of telemedicine platforms that exist, right now, if I, as a customer, or if as a patient, I try to access healthcare, I have to go to bazillion telemedicine platforms eventually to be able to find one doctor who will help me, because right now the supply of doctors is the problem. So in
Yes.
situations like those, I think a unified solution would help, like something that helps get access to the resources. As a patient, I should not be denied care, and that is what healthcare is all about. Nobody who comes to access or requests for help should be denied, but we are seeing failure all across board right now, and it's just heart wrenching. So going back to the remote treatment delivery, what we are trying to do by technology right now is bring all of these platforms together on a unified bus, so that they can access the other end of supply. So let's say I log on to 1mg's healthcare platform, and I'm looking for doctors, but I'm not getting any. Then this common gateway should enable me to still have access to, let's say, practice doctors, because I, as a customer, do not care who I'm going to. I need help right now. So I think that these are works in progress, and we are still working and figuring out how to integrate all of these solutions. But if something like that happens, I think it will greatly enhance the remote treatment delivery by itself as an experience. As
I
far as
think
testing and diagnosis is concerned, sorry, I think we did touch a bit of it across the board. But then, and I think as a country, we are not there yet. We'll need a lot more infra resources for us to get there.
So there's a lot of so I do understand that there is a lot of information, but I think in a country like ours, it's a very diverse country and it's a very complex country also. What is required, looking at my experience in this time also, what needs to be done is access to verified information, because
Hmm.
even in WhatsApp you're getting help, but the question is that help helpful? So when you call up, so you need, whether it's, so you need a platform, or you need a bot kind of a artificial intelligence, where exactly you get verified information, and the person or the patient or a customer, whoever is accessing that bot, should be able to get verified information, and should get exactly that information what the patient or a customer is looking for, because that is need of the hour. And if this can be done, I think it's a complete breakthrough. I think it's a great job done.
I
And
agree.
yeah, so coming to a very interesting subject again, extending this forward. Now what we have, building upon the example that you shared about mobile, one interesting thing is now on mobiles also, and you have these watches also, where these personal devices and variables are beginning to change how we look at data. So they're beginning to change the healthcare with continual monitoring and early warning. Like, even you can measure your, for example, you can measure your BP on a Apple watch, or or even a phone. So, any thoughts on this?
The wearable market, of course, is by itself a great business opportunity. I wouldn't deny that, and I think if a lot of our entrepreneurs can enter in that ecosystem, it's a great place to be. By itself, I think the challenges that industry faces is how how accurate they are, because again, all of this is subjective, right? You can have benchmarks for how an individual's heart rate would be like, or you can give that accurate measurements. But let's say if I'm trying to predict, if I'm trying to say, this is how much sleep you got, and based on that sleep duration, this is how much you should eat, or this is your calorie intake, this is how much your calorie intake should be. For all of that, you need really precise and a lot of precise data from a lot of users. So I think there are technology challenges that we are still facing on reliability of these variables. And the other thing that we have been looking and also it's interesting to see that all of these variables talk in different languages. So for a backend system to eventually integrate the information that I get, it's not easy. So it's in some sense, it's in some sense a part of it is like an opportunity lost, because you have all of this data, like you correctly pointed out, we are just generating massive amount of data, but it's just sitting at that company's server or that company's cloud, and you do not know from health policy perspective, how do I make informed decision. I have this client patient level data, but I do not have access to it, or even if I do have access to it, I don't know how to integrate it in my system, mostly because I speak a different operating system language, or I have different standards in place. So I think going to the first thing all of us, all these devices have to do is move to a common interoperable standard, a common backend, at least from the software architecture perspective. Because until you start doing that, it'll be a yeah, lost opportunity. That's how I see it.
I'm sure that the people, the manufacturers, the entrepreneurs, they understand this challenge which you have just stated. And
Yeah.
even in pandemic, when the market got open for various consumables, so there were no certifications or standards which were available. But eventually, we have good organizations, departmental organizations, which worked in such challenging times, and they actually built up those standards, so that it's easy for everybody to come on board, speak one language, so that
Hmm.
everybody can understand what this data means. I mean, that's the need of the hour.
Yeah.
So
Yeah.
yeah, so basically, one last question before I close.
Sure.
I am from the medical device segment.
Okay.
And I would like to have your inputs on how AI will provide greater intelligence to the medical devices and the machine segment. Any thoughts on this?
Um, See, part of it I did kind of
Yes.
mention, start. There are two ways to look at things. I think as far as devices are concerned, we are still very behind the rest of the world when it comes to medical devices in particular. And it's really good to see, someone who is working in medical devices sector, because we need a lot of medical devices companies.
Absolutely.
The need we can see there. I mean, there's no better time to see that, like right now we don't have enough device manufacturing or even design companies which are in house. So by itself, of course, you're integrating. Don't just look at the hardware, also look at the software. Who is this for, intended for? What is the end consequence, right? With medical devices, I think the problem will always be who's your target demographics. Once you define that, that always, of course, is easier to plug in your AI system. So if your AI system is able to take basics of what your product market fit was into cognizance, then it is being put out to market. And once it is already deployed, it also takes into cognizance that I am going to speak to XYZ systems and be interoperable as far as ecosystem is concerned.
Okay.
Like you mentioned, EHR, right? If I'm making a medical device and I cannot use the output of the data into my EHR directly, then I would probably not want to use that device, right? Because because I'll need a human person now, download in
Yes.
Excel, upload it into another system. You don't want that. So I think just simple things, thinking in terms of how can human intervention be removed, and that's all we are also trying to do. Although we have, there's no dearth of human capital in India, but making it automated just makes fast and also ensures there's a continuum of care. You're not waiting for a person to give a go ahead or transform that or translate that information so that the continuum of care is maintained. I think that's all is the end goal.
Wonderful, wonderful. I think we come to the end of this wonderful session, and thank you, Preeti. It has been a very, very educative and exciting evening. In fact, the projects that you spoke about, many things, I've learned quite a lot. What is happening in the background,
Yeah.
which is in the last 30 minutes, in fact. So thank you very much, and I can now dabble in artificial intelligence kind of concepts and the new projects that you have shared in the healthcare space. I'm sure the viewers here also have found our discussions quite invigorating, exciting, and educative. We look forward to having you again soon. Until then, take care and goodbye. Thank you.
Thank you. Thank you for having me.
Yeah, thanks. Bye. Take care.